Gentlemen, let me share something that has stayed with me for years. A 72-year-old man once sat across from me, looked down at his hands, and said quietly, "Dr. Jocelyn, I've been doing things the same way for over 50 years, but lately something feels wrong." He wasn't sick. He wasn't on new medication. His blood work looked fine, and yet his energy was lower. His sensitivity felt off. His confidence had taken a hit. What was silently affecting his health, his prostate, even his ability to feel pleasure, wasn't what he was doing. It was how he was doing it. This is a conversation far too many older men never get to have. You've probably been told that masturbation is healthy, and it can be when done correctly. But after 60, certain long-standing habits can quietly turn harmful. Not overnight, not dramatically, but slowly, subtly, without a single warning sign. Today, I want to talk to you honestly, respectfully, and without shame. In this video, I'll walk you through 7 common masturbation mistakes men over 60 make and how to correct them before they affect your energy, circulation, prostate comfort, or long-term well-being. And please stay with me, because mistake number 6 is the one I see almost every man get wrong often, with consequences they never connect back to this habit. Before we begin, let me ask you to support this channel. Please like this video so more men can hear this message. Subscribe if you haven't already. I share practical, doctor-guided men's health insights every week. And in the comments, tell me, where are you watching from? This community means a lot to me. Now, let's start with the first mistake, the one that quietly reshapes how your brain experiences pleasure. Let's clear something up right away. Masturbation itself is not harmful. It does not drain you. It does not weaken you by default. What causes problems after 60 is repetition without adaptation. Your body at 65 is not the same body you had at 25. Biologically, several things change with age. Nerve sensitivity becomes more delicate. Blood flow requires more support. Recovery takes longer. The brain's reward system becomes less flexible. Emotionally, this can feel confusing. You may think, why doesn't this feel the same anymore? Practically, many men keep repeating the same habits, same pace, same pressure, same environment without realizing those habits are now working against their bodies. This is not failure. This is feedback. Your body isn't rejecting pleasure. It's asking for a different approach. And that brings us to the first mistake. For those of you who are new here, my name is Dr. Jocelyn. I'm a urology-focused men's health physician, and for the past 5 years, I've worked closely with men over 60 who want to maintain strength, circulation, confidence, and dignity without shame, confusion, or unnecessary fear. I want to be very clear and responsible here. This video is educational. It's not a diagnosis or a prescription. My goal is to help you understand your body better, not to judge it. And one thing I've learned from listening to hundreds of older men is this. Most men are never told how sexual habits should evolve with age. So when something starts to feel off, they assume this must just be aging. Often, it isn't. It's habit mismatch. Let's talk about the habits. Mistake number 1, using porn as the primary stimulus. Many men in their 60s and 70s tell me quietly, "Doc, I don't feel much anymore." They're not broken. They're overstimulated. Biologically, the brain's dopamine system, the system that governs pleasure and motivation, becomes less resilient with age. Constant, high-intensity visual stimulation overwhelms it. Emotionally, this can numb natural desire and make real sensation feel dull. Practically, pleasure becomes mechanical instead of fulfilling. The fix: take a break from visual stimulation. Let your nervous system reset. Relearn pleasure through presence, touch, and breath. Mistake number 2, masturbating while sitting on the toilet. This surprises many men. Sitting hunched forward restricts pelvic blood flow. After 60, circulation is critical. Biologically, compressed arteries and nerves reduce prostate and pelvic support. Practically, this can contribute to discomfort, tension, or weak flow over time. The fix: choose positions that support circulation, standing, reclining, or lying down. Mistake number 3, rushing the experience. Many older men treat it like a task. Let's just get it over with. Biologically, rushing spikes stress hormones instead of releasing calming ones. Emotionally, it leaves you feeling drained instead of satisfied. Practically, it reduces sensitivity and enjoyment over time. The fix: slow down. Your nervous system now thrives on calm, not urgency. Mistake number 4, Ignoring the pelvic floor. The pelvic floor supports erection quality, bladder control, and sensation. Biologically, weak pelvic muscles reduce circulation and nerve signaling. Practically, this can lead to dribbling, reduced firmness, or loss of control. The fix. Gentle pelvic floor awareness, light contractions, and relaxation builds tone and confidence. Mistake number 5. Getting frequency wrong. Too often, it can irritate and drain. Too infrequent can lead to stagnation. Biologically, the body thrives on rhythm. Practically, for many men over 60, once or twice a week, done mindfully, supports balance. Mistake number 6. Using too much pressure. This is the most common and most damaging mistake. Reduced sensitivity leads men to press harder. Biologically, excess force damages delicate nerve tissue over time. Practically, sensation decreases further, creating a harmful cycle. The fix. Gentleness restores feeling. Force destroys it. Mistake number 7. Doing it without emotion or intention. This one matters deeply. When pleasure becomes purely mechanical, the brain stops releasing calming, bonding hormones. Emotionally, men feel empty afterward, not fulfilled. The fix. Bring intention back. Gratitude, breath, presence, connection, even with yourself. Here's how to bring it all together. Reduce visual overstimulation. Choose supportive positions. Slow your pace. Engage. Don't ignore the pelvic floor. Find a natural rhythm. Use gentle touch. Bring awareness and respect back into the moment. These are not restrictions. They are upgrades. Let me speak to you not just as a doctor, but as someone who has listened to many good men struggle silently. You are not broken. You are not past it. You are evolving. Aging is not the end of vitality. It's a shift in how you relate to your body. When you meet that shift with awareness instead of habit, everything changes. If this video helped you, please like it and share it with another man who might need to hear this. Subscribe for weekly guidance rooted in dignity and science. And comment below, where are you watching from? I'm Dr. Jocelyn. Take care of your body. It's still listening. And your best years are not behind you. They're shaped by how you care for yourself now.